Hello.
Hi, ladies.
Hello.
I
Happy
so
Thursday.
wish that we could see everyone and they didn't have to see us.
Yeah.
If you are here, please introduce yourself and say hi in the chat and let us know that you can hear us. Let us know if you can't. And we are super excited to have Natalie on tonight to help us answer some of these questions. I know that there's a very new vaccine, a new pandemic, and so everybody has a ton of questions, and we're so grateful that Natalie took time out of her day to tell us all the latest on what the IVF doctors and ASRM are recommending for COVID vaccine in pregnant women or soon to be pregnant women. So yeah, thank you, Natalie, for being here. I'm Sunshine, by the way. Hi, everyone. If I haven't seen you before, forgive my terrible haircut. Just pretend it's not happening.
Looks great.
Yeah.
Casey.
Yes, you guys all know me, Casey here, and we're really excited to have Natalie. And Natalie, I actually used to work with, and she was a case manager for the company I was doing intake for. So I love Natalie. She's full of knowledge and really is going to be able to give us some insight because she's been doing IVF for a long time. But I'll let her explain her background, and she's an experienced surrogate as well. So you guys are in great hands. She understands really all sides of this. So we are excited to have you, Natalie. Thank you for coming and doing this for us today.
Oh, well, thank you for having me. This is a very important topic from what we're finding in many clinics everywhere. But before I dive deep into our COVID topic, I'll give you a little insight of my background. So I founded Moonlight Injections this month 2 years ago. And that was just my my need for assisting patients with their fertility injections, patients, surrogates, donors of the like, just because there seemed like there was a need for it. It's a tough thing to put your time into something like this, but then to also be expected to go home with all these needles and syringes and medication. And so since I've been in the field for over 15 years, it was something that I felt I could give back to my patients. I was a surrogate in 2011, so I've actually done the medications myself. So I've had that experience firsthand of what it's like day in and day out to go into the monitoring appointments and the ultrasounds and do the embryo transfer and do the injections. So I've really had a fun time connecting with all my patients. And it's been fun. It's been fun connecting with my patients on a more personal level. And my business basically is going in and to their homes and giving them their injections, or just doing a one-on-one personal injection teaching. So teaching patients how to give their injections. So I also work in an IVF clinic in Orange County, and I work as a fertility nurse, back office and front office, and I assist with embryo transfer. So I do the ultrasounds with the doctor. And so I work with my patients firsthand on that level, and that's been a lot of fun. I've been doing that for over 15 years. So hearing the conversations with my doctors and the need for factual information to be shared with our patients is super important when it comes to COVID. So I'm really excited to share this information with you so that you feel like you have reputable information, factual information that's come from the experts who have been doing the research since COVID started. And don't mind me, I'm going to be looking to the side a little because I have a lot of information that I've written down, and it's for me important to give you the facts and the details and the statistics and the true numbers. So I hope that's not too much of a distraction. So there is an overall risk with severe illness in low, the severe illness is low in pregnant and recently pregnant people, at an increased risk of severe illness for COVID when it's compared to non-pregnant women. So we're still seeing a high risk for women when pregnant for COVID specifically. So even though the risk is low, it is still considered a high risk for severe illness. Severe illness includes illnesses that require hospitalizations, intensive care unit, a need for ventilator and special equipment, and also illness that can result in death. So a lot of our OBGYN doctors are seeing a higher risk for severe reaction or illness for our patients. And there is this need for sharing this information to our patients because there's a fear with the new vaccine or something coming out so quickly when compared to immunity and gaining and kind of getting through the COVID virus itself. So as of October 8th, COVID cases, hospitalizations, and death are once again declining, which is a good thing. But sadly, the United States reached a grim milestone this week, surpassing 700,000 total deaths from COVID. That's a lot when we're looking at statistics and patients being admitted into hospitals. Now, specific to pregnancy and surrogacy, we've had some of you ladies submit some questions. So I'm going to go through the questions and I'm going to go through the answers and research that I found. And then afterwards, if you guys want to input your questions in the chat, I'd be happy to help. I don't know all the answers, but of course, if there's some questions that would be harder to answer that may be better coming from a physician, I can connect you guys to more information. So one of the questions that was submitted was, what are the pros and cons of each vaccine as they pertain to women? For example, the J&J vaccine, as we have heard, has given some patients blood clots. Also, Pfizer is possibly affecting menstrual cycles. So are there side effects, and which one has the lowest risk? So currently right now, there's no preference for a COVID vaccine. So however, 12 through 17-year-olds are eligible to receive the Pfizer only, and none of the other two, which is the Moderna and the J&J. So when we're talking about high risk for side effects, let's start with the mRNA, which is messenger RNA. This vaccine works by teaching the body and the cells to make a harmless piece of spike protein. So that spike protein is found on the surface of the virus of COVID. And after our cells make copies of that protein, they destroy the material, and then they generate that protein that should be there and built with the T cells, the T lymphocytes and the B lymphocytes. So that will, those will remember the virus so that in the future, the body reacts and knows to fight off that virus. So it's just a spike protein. And this vaccine is not a live virus. So I know a lot of patients are concerned with being injected with a live virus. This is not one of those. mRNA vaccines are the fewer forms of vaccines. They're new, but they're not, it's a newer vaccine, but the mRNA is not new to us. Research and study began back in the late 70s. The first vaccine study began in the 90s. So we have over 20 years of experience with mRNA. So I know a lot of patients are hesitant because it's a newer form of vaccine, but we've been in research with this one for a very long time. There is a really good article on the history of mRNA. I'd be happy to share a link so you can gain more information on kind of where that's headed, where it came from. Currently available mRNA-based COVID vaccines from Pfizer and Moderna have documented safety and efficacy in large randomized clinical studies, preventing up to 95% of severe disease. So yes, it's true. It can't prevent from contracting COVID, but it will help minimize the severity of the illness from COVID. So the second vaccine is the vector vaccine, which is the J&J. So that contains a modified version of the different virus than the one caused by COVID. So inside the shell of the modified virus, there's a material from the virus that causes COVID. So this is called a viral vector. Once the viral vector is inside our cells, the genetic material gives cells instructions to make the protein that is unique to the virus that causes COVID. So using these instructions, our cells make copies of the protein. So it's making copies of that protein. This prompts our bodies to build T lymphocytes and B lymphocytes that will remember how to fight the virus. So both of these are kind of recognizing the virus. Again, it's not a live virus that we're giving patients with this vaccine. Previous examples of a vector vaccine, scientists began creating viral vectors in the 70s. So besides being used in vaccines, biovectors have also been studied for gene therapy, to treat cancer, and for molecular biology research. So some vaccines recently used were for Ebola outbreaks. And also a number of studies have focused on viral vector vaccines against infections such as Zika, flu, and HIV. Let's see. It also is effective in preventing severe and critical COVID illness after a single dose. So this is the one that is just required to have a single dose. This vaccine demonstrated 93.1% of effectiveness in preventing hospitalizations 14 days following the vaccine. So for all the vaccines, full immunization is 2 weeks after receiving the vaccine. So there is a concern for serious side effects. The known and potential benefits of these vaccines outweigh the known and potential harm of COVID infections. And that's where the OB doctors and specialists are seeing that yes, there is potential harm, but there's so much more benefit from the vaccine. And the serious side effects are minimal. And the research has shown that it does not outweigh the positive outcome from having a vaccine. So let's go through a couple that patients have seen. The thrombosis with thrombocytopenia syndrome, which is TSS, it's basically blood clots with low platelets. Patients have seen this after Johnson & Johnson vaccine. So as of September 29th, 2021, more than 14.9 million doses of J&J vaccine have been administered in the United States. CDC and FDA they identified 47 confirmed reports of people who got the Johnson or J&J vaccine and later developed this TTS, which is the blood clots. Women younger than 50 years old especially should be aware of this rare but increased risk of adverse event. There are other options available though. So what the doctors are saying that yes, there is a risk for women under 50, but there are the other two vaccines available, so we can avoid this one if there is a major concern. There's lots of information on the CDC with this and the statistics, but the alternative is one of the other vaccines. So to date, 2 confirmed cases of TTS following the mRNA vaccine Moderna has been reported after more than 376 million doses. So there's a very minimal risk of blood clotting when it comes to Moderna vaccine. The other concern was effects on menstrual cycle. So we've heard a lot of patients concerned with the vaccine causing abnormal menstrual cycles. And I found a really good article when it came to this on ACOG, which was actually from a Dr. Mary Rosser. She's an OBGYN. She has a PhD in endocrinology, and she's an assistant professor at Columbia University. And she wrote this really good article about menstrual cycles and the COVID vaccine. And one of her inserts from this article really kind of helped to give you an idea of what these physicians feel as far as this topic. She stated that this is a complex question because there are many reasons why your period may change. So during the pandemic, we saw a lot of things. We saw stress levels increase with job changes or, being put to stay at home and not being able to go anywhere. So lots of women were eating more, or we were moving less and not exercising. We were gaining weight. Stress and weight gain are just two examples of changes that affect your menstrual cycle. So with all these happening, plus getting the vaccine, and then the stress of just receiving a vaccine in itself was really stressful for patients. So Dr. Rosser says that she assures her patients that having 1 or 2 abnormal periods is not a sign of infertility. So if you have abnormal periods, usually your periods will return normal within 1 to 2 months. Temporary period changes are super common. So again, there's no real base as to the findings or information out there about missed periods. And none of the physicians in the field feel like that's a huge concern. They've not seen any drop in fertility rates for patients before or after the vaccine was received. What the OB doctors are more concerned with, the bigger concern, is contracting COVID and then having what they call post-COVID or long COVID. So a lot of these OBGYNs are seeing that this is more a concern than receiving the vaccine itself. So while most are concerned with the effects of the vaccine, there's also a concern for long COVID. These symptoms can occur in anyone who has had COVID, whether it was mild or if they experienced no symptoms during the time they had COVID at all. And this is a really long list of symptoms. And I'm just going to read you a short of what these symptoms can entail: difficulty breathing, shortness of breath, tired or fatigue, symptoms that get worse after physical or mental activity, difficulty thinking or concentrating, cough, chest or stomach pain, headache, fast beating or pounding heart, joint or muscle pain, pins and needles feeling, diarrhea, sleep problems, fever, and of course, at the very end, mood changes, changes in menstrual cycle. So even COVID can have that effect on your menstrual cycle. But doctors are more concerned with the long COVID than actually the side effects from the vaccine, which is very minimal. For most patients, it's flu-like symptoms. More importantly, a fever. And I know there's been concern with fever in women who are pregnant, but they feel that the risk of COVID outweighs the concern with the fever. And let's see, we have a question from Brittany. She got the Pfizer and her cycle, was every 28 days for the past 4 years. She got the vaccine, her period started every 25, then 29, 26. Yeah, so some did notice a little difference, and we've heard that from many patients, but from the research, there's been no significant jump in changes to the patients concerning fertility, or even from the OBGYN doctors. There may be a change, like we said, stress related, just the stress of getting the injection and being very concerned for your overall well-being and health. That in itself can change. We see in a lot of fertility patients, when we tell patients, okay, call us on day 1 of your period. Well, we all know when we say, okay, we're going to sit here and wait for our period, that's going to change the timeline, and your period's going to be late just because we're trying to wait and expect for it to happen. Okay. So another question we had was getting the COVID vaccine while pregnant. Is that safe? So early data suggests receiving the mRNA COVID vaccine during pregnancy reduces the risk of infection. So this came from both ACOG, CDC, ASRM. They're all seeing these same findings. A recent study from Israel compared pregnant people who received the mRNA COVID vaccine to those who did not, and scientists didn't find that the vaccine lowered the risk. Scientists found that vaccine lowered the risk of infection from virus of COVID. So they saw an increase in preventing women and COVID in pregnant women. But they're also, they know that it's preventing the higher risk of hospitalization. So again, the risk outweighs the concerns with the vaccine. There was a statement issued by the CDC, which was super important this last month in September. On September 29th, the CDC issued a statement, a strong advisory, strongly recommending COVID vaccines either before or during pregnancy because of the benefits of vaccine for both pregnant persons and their fetus or infant outweigh potential risk. So the statement went on to address a few things. Only 31% of pregnant people have been vaccinated against COVID-19 at this time. Through September 27th, there were more than 125,000 cases confirmed of COVID in pregnant people. That including more than 22,000 hospitalized and 161 deaths, which 22 deaths alone occurred in the month of August. So they were seeing this higher risk in pregnant women when before perfectly healthy, no severe issues, but they were seeing the COVID was really making these patients become a higher risk and be admitted into the hospitals. Rima, I do see your question about long-term effects of the vaccine. So right now, from what I'm reading and what the research is there's no long-term concerns at all because these are all such short-term and antibodies. And we're seeing that it's kind of like the flu vaccine. You're having to get a flu vaccine every year now. There's no real concern or evidence that there are any long-term effects with the vaccine. What they are seeing is that there are long-term effects from COVID itself, from the virus. And I went over that long list of side effects. Those are the long-term effects that they're seeing with COVID, but none at this point that they're seeing from the vaccine. And keep in mind that we're going into 2 years at this point of actually administering the vaccine to patients. So as we're building all of this data, and 2 years is a long time to kind of do the research and follow these patients. And I'll go over there are some ways that CDC and some of the other organizations are monitoring patients, specifically pregnant women, in regards to the COVID vaccine. So they've begun monitoring these patients as we move forward. They have a monitoring system in place. So as we continue, they're only going to build more information, which is great. The next question is, how safe is the vaccine for unborn children if vaccinated before transfer? So that's the $1 million question for a lot of our surrogates, because it's a careful consideration of wanting to be mindful of your own health and mindful of the intended parents and the baby that you're carrying. So I did research on a few articles that I read from reputable doctors and research studies that they've been doing. And ACOG had a really cool article with research that they've done. There was a prospective cohort study from 2 academic centers found that vaccinated pregnant and lactating women produced comparable immune response to non-pregnant controls. So the higher antibody titers, they generated higher antibody titers than those observed following SARS-CoV infection with pregnancy. So they were seeing a higher titer in antibodies from those receiving the vaccine versus those who contracted COVID, which was very interesting. And further, the vaccine generated antibodies were present in the umbilical cord and the breast milk from maternal vaccination. So they're finding that there's also some sort of immunity building for the newborn or the infant as well, which is great. So they're seeing that as a positive. They're not seeing any other effects or concerns. But the great news is that they're seeing a higher titer of antibodies when receiving the vaccine. Because I know there's a lot of concern also of a lot of information out there stating that you can build just as much immunity from having gotten COVID than from actually getting the vaccine. And so those pieces of information are still being researched, and there's a lot of back and forth. But from this specific study pertaining to pregnant women, they are seeing the higher titers in the vaccinated than those who have had COVID itself. The other question that came in was boosters, yay or nay? So right now, booster shots are the topic of conversation, and they're only available for the Pfizer vaccine. And right now, there's a few different groups of people that they're recommending that this vaccine are the boosters given to. So only if you fall within those groups is it recommended. And let me go over those really quick. So it's people age 65 years and older, and adults 50 to 64 with underlying conditions. Residents aged 18 or older of long-term care facilities. People aged 18 to 49 years with underlying medical conditions based on their individual benefits and risks. People aged 18 to 64 at a risk of COVID exposure and transmission because of occupational or institutional settings based on their individual benefit and risk. So some of those examples for occupational settings could be first responders, educators if you're a teacher, food and agricultural workers, manufacturing workers, corrections workers, U.S. Postal Service, public transit workers, and grocery store workers. So if you were to fall in any of those categories before getting the vaccine, you can always consult with your primary doctor. Having a good game plan, especially if you have an underlying condition, the last thing we want to do is have you exposed to COVID and then it become a super high risk situation. And so I'm sure a lot of you being surrogates have gone through your whole medical history, and most of you don't have underlying conditions. But if you're in an occupation that would expose you, maybe it would be best to consider the vaccine. So currently there are several monitoring systems in place to continue collecting health information pertaining to COVID. So I mentioned this earlier. So how are we monitoring these pregnant women throughout this time to see how are we getting this information on, how they're responding and the antibodies and the titers. And so currently there is a vaccine adverse event reporting system which is called VAERS. And this is a reporting system that the physicians are submitting information to. So if they have a patient with an adverse reaction, or if there's anything that comes up that's significant throughout the period of the patient getting the vaccine, the doctors are actually submitting. CDC also has what they call VSafe. It's a vaccine pregnancy registry. Well, VSafe, they have two different. There's patients that can submit after getting the vaccine, but specifically there's a pregnancy registry. So if you're pregnant and you receive the vaccine, you can register on CDC and they'll monitor and send you text messages with questions so they can kind of closely monitor your response and the outcome and how you're doing. So again, we're close to 2 years of data with ongoing vaccinations, and we'll have continued updates and information that'll become available. But most of the doctors that I talk to, they can't state it more, just for the safety of their patients, that the vaccine is just the safest route because it's safeguarding you from potential higher risk, especially for you surrogates who are considering becoming pregnant. That puts you in a high risk category. And there's lots of physicians who are advocating for this. Vaccine monitoring has historically shown that side effects generally happen within 6 weeks of receiving the vaccine. So for this reason, the FDA requires each of the authorized COVID vaccines to be studied for at least 2 months, which is 8 weeks after final dose. So it started before and it continues to go on. And as we move forward, we know we're just going to have more information. There are some really cool doctors on social media that are sharing information. Dr. Crawford is one. I can send and share links on my pages with these doctors who are daily submitting information on their social media of just the statistics and what they're finding. And these are the doctors that are day in and day out meeting with these patients and seeing just how horrible it is that they're having to counsel these patients after, contracting COVID and then being in the hospital. And I know it's hard because there are a lot of platforms on social media, and there's a lot of misinformation. So it's knowing where to get your information from. And again, the CDC is great. ASRM is great. ACOG is also great. That's the College of Obstetrics and Gynecology, specific to pregnant women. So they're always putting out great information for our patients. And turning to the specialists, the doctors. So asking your physicians, what they think and what your options are. But I know it's scary and there's a lot of information, but as we move forward, there's going to be even more. So that's pretty much the details I have as far as the main questions and concerns that have been happening throughout our time with COVID and the vaccines. And I don't see any other messages in the chat, but if anybody has any other questions at this point, you can submit them in the chat room. I'd be happy to help answer. And I think we are done. I'll also share my email with the ladies at Surrogacy is. So if there's any personal questions or anything that you'd like to send that I can help you kind of navigate, you can send those directly to me and I'd be happy to help you ladies. And thank you again for joining.
Casey and I are together again.
Yeah.
Thank you guys so much for coming on and for spending this time with us. Thank you so much, Natalie. If you guys ever have any more questions, feel free to reach out. Natalie, can you share your email address in the chat so they can email you?
Yeah, absolutely.
And I will share it in the Facebook group as well, so you guys can know. The replay will be sent out to you, so you guys can watch this later, and we'll put it up on our YouTube channel too. So have a good night, everyone. Casey and I are going to go eat some pizza.
Ooh.
It's frozen pizza, but
Hey, it's okay.
Pizza.
All right. Bye.
Bye,
Thank
ladies.
you.
Thank you.
Bye.
How do we get out of here?